Hi, my name is Simon. This is my colleague Regis, and we're both chartered physiotherapists from Soho Physiotherapy, based at Tri Yoga Centre, Soho, Central London. Today I'm going to have a look at taping for ankle sprains, and there are two taping techniques that I'm going to show you. One is to stabilise the ankle and improve proprioception or balance, and the other is to protect the ankle from spraining again, which is easily done. So here we go. First of all, the taping for stability, proprioception and balance. So quite often with an ankle inversion injury, apart from tearing the main ligament, the anterior talofibular ligament, you've also damaged what we call the retinacular or binding ligament around this ankle bone here, the lateral malleolus. So first of all, we just have to stabilize this lateral malleolus. And that's like tuning a radio that's not quite tuned and you can't quite hear the words. So once we stabilize that, the body can get some clear signals up, and that will straight away improve the proprioceptional balance. So here we go. I'm cutting a piece of fixamil tape here. This white tape protects the skin while I place the fabric tape on to do the holding job. So I'm going to take a strip about 8 inches long. Okay, Regis, just pull your foot up and we tape 2 inches in front of the lateral malleolus and just lay the tape around like so. Then I get a bit of my fabric tape or zinc oxide tape. Now, I just lay this over the top, just in front of the joint line there. Now, I'm not pulling the tape tight. All I'm doing is just gently keeping the foot in dorsiflexion, gently pushing down, taking up the slack and holding it around. Because I don't want to create more joint compressive forces, but I want that to be stable. And then, of course, we have to make sure it stays secure, so I'm just going to put some anchorage taping on. So that's half on the tape that's already on and half off on new skin, so we get more anchorage. Great. So that's all you need to do just for proprioception. Now, to prevent the ankle going over again, I'm going to do the stirrup taping. Regis, could you just move down a little bit, please? This is something that we do with our football players when they've had an ankle injury, so they can get back to playing without the risk of injuring again. So, I'm going to place some anchor tape on here. And then I'm going to do a stirrup. Now, with an ankle sprain, the ankle goes around that way. So it's important I take from the inside, taking the ankle back out into that position so that we prevent it from spraining in the inversion position. So I take my tape and I place a stirrup around the ankle. Remember, it goes from the inside, a stirrup around the heel, and then just in front of this lateral malleolus, up the side here. So that's my protective tape. I'll take my zinc oxide fabric tape once more. I'm going from the inside, providing my stirrup, making sure we've got the foot in dorsiflexion and eversion. There we go. And I'm just going to make it secure now. Great. And finally, we like to take pride in our work, so let's just tidy it up. So this is flapping around here, so let's take that down so it doesn't roll back on itself, and it gives extra anchorage. Just lift the leg up a moment, Regis. That's good. Nearly there. Great. Okay, Regis, if you'd like to step down now. Please, if you'd like to stand, Regis. So, if you like to flex and dorsiflex your ankle, do you feel that is restricting your movement at all? Great. So the great thing about the tape is that it allows the ankle to go through its normal range of movement without restriction. However, if you were to go over on your ankle, Regis, do you feel the tape kicking in? Yeah. So the tape, in effect, is a temporary reconstruction of the anterior talofibular ligament, and it protects the ligament while it's healing up. Because if you go over on your ankle, it's often all or nothing. So we keep this on for about 3 weeks, replacing it each day until the ankle is good and strong and healed up again. Thanks for your time today. I hope you've enjoyed our little video. Bye for now.